Hey everyone, welcome to the video. Today we are going to be doing some Vsoft smooth threads into the submental area. So you can see right now I just have some topical numbing on her. That's been on for about 10 minutes, so I'm going to go ahead and get her cleaned off and ready to go. So I usually like to use, this is just like a makeup wipe to get all of the topical off the skin, make sure she's good and clean, and then I'm going to use alcohol as my disinfectant. So let me just get her clean and then we'll kind of talk about her markings. So this is an area that we frequently treat on her. When we initially started, I don't even know when that was, maybe a couple of years ago?
3 years ago.
Yeah. We did series. So we usually recommend at least 3 treatments, 4 to 6 weeks apart. And that's what I do, when I'm starting out. Now she kind of gets it done every so often just to kind of maintain. I usually like to do the series at least once a year just to keep up with that collagen production. And what I like to do is kind of focus just right here on this area. So we've come a long way. It looks really good. And I just kind of draw what I think would be best for her. And I tend to go with this pattern in this area only because it focuses on the main pocket here, but also placing the threads laterally will help to tighten up this area as well, which will help give her a little bit more of a defined jawline. 1, 2, 3, 4. So I have 10 threads that I'm going to use. I think I drew 11 marks, but I'll just kind of eyeball it. I'm going to lay her on back. Maybe, there we go. For today, I think when I first started with her, we were using the 29x30 mono threads. Since then, I've switched to the 2940 twisted threads. So I find that these give a little bit more collagen. You can see the thread itself is twisted around the needle. I know it's probably hard to see, but you can see that it's twisted around there. So it's kind of like double the collagen, which is what we want. So I like to pull the skin back nice and tight. And then once you see that bevel pop through, just advance. And that's it. I'm just gonna kind of let them be until I'm done, and then I'll twist them all together. You'll see that with the twisted threads, we always get questions about them because they tend to be a little bit more difficult to place. Once you meet the little pledget, or the little marshmallow, what we call it, you have to give it an extra little push to pop it in and try to get it as close to the pink hub as possible. That way when you actually remove the needle, the thread stays behind. Pulling the skin tight obviously helps, and slipping the needle in. Most patients do really well with this. Some areas with smooth threads tend to be a little bit more pinchy than others, but this is definitely a quick procedure. I'm doing 10. Sometimes it requires more. As I said, we've come a long way with her, so I think in the beginning I was probably using like closer to 15. And now that we've kind of achieved good results and we're just trying to maintain, I'm now using 10. But it typically just depends on the patient and how much excess tissue is there that you're trying to tighten up. So the threads themselves will start to dissolve usually around 4 weeks. So in that 4-week time span, the patient may get what we call like little zingers. I'm just going to go ahead and start twisting these. But they'll get little zingers. So sometimes the threads kind of like rub each other and touch. Like if she turns her head in a certain way, they'll kind of poke and they'll feel it. And it's usually just like a little zinger and then it goes away. Not too painful, just more annoying than anything. And then usually at that 4-week mark, when they start to dissolve, those will kind of go away. And then the peak collagen production is going to be around that 3 to 6 month mark. So you can see I twisted all of them 360 degrees. Excuse me. Put gentle pressure over the needle, removed and the thread is behind. Minimal bleeding, nothing crazy. I'm just going to get her cleaned up. Most patients are going to get a little red and irritated, mostly from topical and the alcohol. And that is it. Downtime is not much. Usually I just tell the patient, don't exercise today and don't apply any makeup to the area. Just keep it clean until those sites heal over, and then she will be good to go. How was it?
Good.
Not too bad, right?
Oh yeah, we've come a long way.
Yes. She's an expert now.